Charlene, it's such an honor to have you here in Nurses Outside the Box. You are such a nurse outside the box. It's like if anybody is one, Charlene, I think it's you. It really is. So welcome. So wonderful to have you here.
Thank you so much for having me, Anne-Marie. I really appreciate it. And it's really an honor to be here. So thank you.
So welcome. So the first thing I always love to ask people as they come on these interviews is what are you currently doing as a nurse that makes you a nurse outside the box? What do you think that is?
Yeah, that's a great question. And there's a few different hats that I'm wearing right now. And, my current full-time position is at Stanford Healthcare, and I currently work as Director of Ambulatory Nursing, which that on its own is already outside of the box because it's outside of the inpatient setting. And so I'm really looking forward to that role because I have the opportunity to help with innovations in the ambulatory space for nursing. And on top of that, I'm also one of the 12 inaugural Johnson & Johnson Nurse Innovation Fellows. And I know that you had interviewed Eric Anderson, and he's definitely one of my co-fellow members, and he's amazing. And I'm so glad that you had the chance to talk with him. And in this program, definitely one of my goals is to bring nurse-led innovation to the forefront and to continue to help implement mechanisms for nurses to bring their ideas forward and get that into action. So definitely another way to be a nurse outside of the box, trying to think about how can we really think of nurses as innovators and how can we really get their ideas heard. So
let's kind of dive into that a little bit because you just mentioned a whole bunch of stuff, right? And I would love to hear from you, first of all, a little bit about your story. Is how did you get here? Because Stanford Health, right? And that's phenomenal in itself. We'll definitely go into Johnson & Johnson Fellowship as well. But I'm curious, how did that start? Why did you start as a nurse and how did that develop? I'd love to hear more about that.
Yeah, so nursing is my whole career. So I haven't had any other career actually. And, the reason why I found out about nursing first and foremost is because I come from a family of nurses. And so my mother is an ICU registered nurse. My twin sister is a registered nurse. And I have other family members, and I'm a twin too. So, so that's always a fun fact. And so I come from a family of nurses, and that really introduced me to the field. But what really solidified my decision to come into nursing was the interactions that I had with my patients and really the experience I had knowing that I could directly impact patient care for the better and really improve a patient's experience. And so I started off working as a nursing assistant at UCI Medical Center, and that was a great way to be introduced into the healthcare system and know how the system works and how complex it is. And then I also worked in the outpatient space for a nonprofit organization that was focused on helping homeless patients who were being discharged and who needed to be transitioned back into the community. And so that was already a very eye-opening, very amazing experience working with patients there. And then, from that, I became a nurse in the acute care setting as a nurse in the hospital. And so when I was a nurse in the hospital, it really opened my eyes to a lot of the ways that healthcare could be improved and how we could improve our infrastructure. And I found myself caring a lot about how can we make things better? How can we make things better? At the time, I only thought of that as, performance improvement, process improvement. And so I didn't actually think about the term innovation or nurse-led innovation until last year, when all of this movement with that term and with the Nurse Innovation Fellowship became more popular. And so, so that really, the experience that I had with inpatient setting and being able to directly impact the care that the patients had really pushed me to want to impact patients on a broader level. And so that's more of how I got more involved in the systems and more in this innovative space.
Tell us about the Johnson & Johnson Fellowship, because that's what you talked about last year, right? That's what came about. I'd love to hear a little more. Yes, I've interviewed Eric, but I would love to hear a little more about your experience and what you want to, how you're moving on with it, because you're in the midst of it, right? In the middle of it.
Yeah, absolutely. And I first found out about the Johnson & Johnson Nurse Innovation Fellowship because of Rebecca Love. And she is the first nurse who was on the TED stage, and she talked about nurse-led innovation. And that was really the first time that I heard that term. And I thought, wow, that's so interesting. I never thought about it that way before, but it's absolutely true. We've been innovating this whole time. And so when I saw that presentation from Rebecca, I connected with her on LinkedIn. And then from that connection, I found out that she was helping to co-facilitate the Johnson & Johnson Nurse Innovation Fellowship. And so I was fortunate to be accepted into this inaugural cohort. And so it's just really exciting because, you know, being in this group with 11 other nurses really opens your eyes to the great work that everyone's doing. And so, you know, the program is 2 years in total, and you get to choose an innovation project that you're working on. But you're also introduced to so many other innovators, so many other opportunities to help promote nursing and promote nurse-led innovation.
I love that. And then, of course, the whole thing with COVID came about, right? Which we at that point we didn't know about. And so I
Mm-hmm.
think that a lot of has come from that as well. So how have you experienced the whole situation with COVID, especially as it relates to innovation? We'd love to hear more about it.
Yeah, so definitely, you know, with COVID-19, I mean, so many challenges came about that, and we really saw once COVID started to affect us personally and me personally and where I work and where I live. You know, I just saw how much the global pandemic really highlighted the need for support in our healthcare infrastructure. And so there was a lot of challenges that came with it. You know, there was the challenge of access to care for patients. There was the challenge of nurses and personal protective equipment. There was a challenge of trying to navigate something that was unprecedented and a constantly changing flow of information. And we would have guidelines changing every hour. And so it's really, really tough to navigate, and knowing how to inform your staff and how to go about everything in the right way without making sure, you know, while making sure that people are safe too. And so definitely a lot of room for innovation with COVID-19. And that does actually really relate to the hackathon that happened just this past weekend. You know, there was the Nurse Hack for Health COVID-19 virtual hackathon. And so it was this partnership with Johnson & Johnson, Microsoft, Sanciel, and DevUp conference, and it was all focused on innovation and innovative ideas for COVID-19. So that was definitely something I wanted to participate in.
That was a global experience, right? There were nurses from all over. I saw from
Yeah,
Germany and
yeah,
yeah, that's awesome.
absolutely. There were nurses from all over the world that participated, and that was really amazing to see. And it just goes to show you how many nurses around the world and how many people around the world really want to help and contribute.
Yeah. Tell us about it because I know you want to. You and your team want. It's awesome, which is an amazing experience. I'd love to hear a little more about what was it like and what did you do? What actually was the proposal that you guys won with?
Yeah, so I mean it's really great that we won, and I mean that was really exciting, and but I do believe that everyone won by, you know, by participating. And you know, there were 5 different tracks and 5 different challenges that you could join as part of the hackathon, and I chose to participate into the resiliency and self-care challenge. And as a nurse, personally, I've faced myself a lot of issues and challenges with resiliency and self-care in the healthcare industry. And with the global pandemic and seeing, you know, the staff and seeing nurses and other advanced practice nurses facing these challenges, I know it's so difficult, and it's something that we're going to continue to need for years to come. And so really interventions for how do we tackle this challenge of nurses facing so many mental health distress and stressors as a result of COVID-19, but also all of these other things combined. So, you know, we already know that nurses and healthcare professionals are burnt out, but with this pandemic, it really, really multiplied that by so much more. And so we know that there's a great need for this. And so with the hackathon, I was able to join a team with Chris Caulfield, and he's a chief nursing officer and co-founder of IntelliCare, and that's a nursing staffing software for post-acute care facilities. And he's an amazing nurse entrepreneur and innovator, and I was really excited to be part of his team. And when we joined the hackathon, we just organically grew our team because we had so many nurses who saw that we wanted to help with coping interventions for nurses on the front line or nurses who are facing challenges with COVID-19. And so we had a team with 8 nurses, with myself and Chris included, and then 2 technical experts who could help us with the business development and the UX and the user interface for the application. So we really wanted to create a mobile application that could help with coping strategies for the mental health challenges that these professionals are facing.
Wow. And so is that in the process? Is it something you can continue with, or what does it look like right now?
Yeah, so the great thing is that since this was such a huge partnership with all these different organizations, we will have the ability to continue to connect with Microsoft, with Johnson and Johnson, and with Sanciel and DevUp conference. And we are really looking to make this idea a reality. And so the idea that we came up with was an application called Well Nurse, which is a play on wellness. And so we included a lot of different aspects of that, which could be a great nursing specific intervention for nurses. And so more to come on that. But I think that we could potentially see that in the market. And I'm just really excited for the future of wellness and really, really hope it comes into reality and helps nurses out there.
Wow, that's amazing. I love your story. I mean, I feel amazing story. What do you see moving on as you're moving into the future with, you're right, a lot of changes has happened because of COVID-19, but especially for nurses and innovation, because it feels like it's at the same time, right? There's this flux coming up of nurses really making a change. What do you see, and what would you say to nurses who are interested in doing this part as well?
Yeah, I mean, just from the Nurse Innovation Fellowship alone, and with all of the spread of information of this program and different types of nurse-led innovation, I've had so many nurses reach out to me just expressing their interest in participating and how can they innovate and help within their organizations. And so I see that this movement only continues to grow. And we had this global pandemic really highlighting nurses at the front line and in the spotlight, which is something that nurses have historically not been. I mean, we haven't been in the spotlight in this type of a way before. So this is really showcasing nurses in a way that we didn't ask for, but it was really necessary. And so I see that this movement will only continue to grow, that there will only continue to be more programs and more platforms for nurses to share their ideas within their healthcare organizations. I'm actually trying to work on that right now with Stanford Healthcare to expand the ways in which nurses can bring their ideas forward so that we could see that and help make that into a reality. And so I think that it is my hope that other healthcare organizations will do the same. And so I really would like to see more nurses making key healthcare decisions, more nurses in boardrooms, more nurses on advisory boards, and in innovation fellowships and in innovation labs all over the world. So that's really my hope, that after this pandemic is over and after 2020 is over, that we continue to include nurses and think of nurses and leverage nurses in all these different aspects.
Beautiful. I love that. If nurses are interested, how can they get in touch with you? And I guess I want to give you the last word. If there's a nurse listening right now and they're like, I don't know in the world, how am I going to start with all of this? I would love for you to address that. See, what would you say to that?
Yeah, so I am on social media. So if anyone wants to connect with me, I'm definitely on Twitter. My handle is at Charlene Platon. And I'm also on LinkedIn, and primarily on LinkedIn because it's such a great network. And that's how I've met so many other nurse innovators. And so definitely add me on LinkedIn. You could find my name through just typing Charlene Platon. And then you could just, send me a message, connect with me. And I would love to meet with nurses who are interested in this. And if they aren't sure where to start, I'm happy to chat with nurses about that. I just think the most important thing is that if you have an idea and you want to help improve your healthcare organization, see what's out there, see who you could talk to. Most people will talk to their managers and see if their ideas could be moved forward that way. But a lot of time I know that ideas also stop there. So if their idea does stop there, I would encourage all nurses to continue looking for other platforms outside of their healthcare organization. They could join Sanciel, they could join, it's the Society of Nurse Entrepreneurs, Innovators, and Leaders. And so they should definitely join organizations like that. They should definitely look at other platforms where nurse innovators are located. So definitely on LinkedIn, on Facebook, and meet other like-minded nurses. We're it's such a great community that, we all are just willing to help out nurses who are interested.
Beautiful. Thank you so much. You have been such a wealth of information. For anybody who's listening, please, there are going to be comments below. Please put your comments below. Connect, because I think you're right. But what I hear you saying is like nurses really need to connect, right? They need to have their voices be heard. They need to be out there in the communities and everything else. So thank
Absolutely.
you. Yeah, this has been a delight for you to talk to you and to see everything you're doing. And there's going to be so much more. I feel like you're moving into a whole new future with all of this too. So thank you so much. And thank you again. And hopefully in the future we'll talk more and we'll talk again. And one last word for any encouragement for nurses, what would we be? What would you say?
Yeah, I would say all nurses are innovators. So many nurses have great ideas. Definitely get them heard and get them out there. And another thing I would say is that, if you come into challenges or obstacles, it's all part of the process. A lot of people may stop because they face failure, or they might, but failure is all part of the process. I failed so many times that I wouldn't be here today if I didn't have those experiences. And so I would encourage any challenge, or anyone who's, if you face anyone who's a naysayer, definitely, listen to yourself, listen to your gut and your passion, and that will always steer you in the right direction. So please keep that in mind.
Thank you. We'll end with that. Follow your gut, guys. Okay. Thank you.
Thank you, Anne Marie.